All right, thank you. This past weekend marked the 36th anniversary of the first heart transplant at Hartford Hospital. And since then, the hospital has performed 469 heart transplants, improving the quality of life for patients and their families profoundly. The hospital has come a long way from that first transplant in 1984. And here to discuss the innovation is Dr. Jonathan Hammond, a cardiac transplant surgeon at Hartford Hospital. Doctor, welcome.
Thank you. Pleasure to be here.
Oh, we're glad to have you. So how has heart transplant technology changed over the last 36 years?
Well, it's interesting. The cutting and sewing involved with the operation really hasn't changed all that much since our first transplant in 1984. But there have been major advances in two other areas of the transplant process. One of them has to do with how we take care of the heart from the time we recover it until the time it's implanted. Traditionally, we've just put it on ice, but that has its limits. You can imagine that if I asked you to hold your breath for a minute, and then asked you to run a 100-yard dash, you'd have trouble with it. So now we have a way to pump blood through the heart while it's outside of the body, allowing it to continue to beat while it's transported, which should be a better way to preserve the heart during the time it's outside the body. The other area where there have been major advances has been in the area of pumps that can be used to support somebody whose heart is not working well. This can come in the form of temporary devices that can be used to resuscitate somebody who's critically ill with heart failure. It can also come in the form of long-term battery-powered implantable devices that can allow people with heart failure to lead productive lives outside the hospital.
All right, doctor, what do these advancements mean for the patient?
Well, in terms of the heart preservation device, it means we can accept hearts for greater distances without worrying about whether the amount of time the heart is spending outside the body will compromise its function. That means we have a better way of getting hearts to those in most need with the shortest waiting time. In the terms of the temporary pumps, it means that if somebody is literally dying of heart failure, we can resuscitate them and make a candidate for a transplant. Or if they're not ready for a transplant but are in a bad way, we can keep them alive for up to 10 years with fulfilling and active lives with the implantable, durable, battery-powered device.
All right, what sets Hartford Hospital apart when it comes to heart transplant surgery?
Well, heart transplantation is the ultimate team sport, and I think we've got a team that's second to none. We have surgeons with over 25 years of experience, but it takes more than just cutting and sewing to make a program. We have a dedicated team of heart failure cardiologists who help manage the patients before and after their transplant. We have a team of anesthesiologists and intensivists who manage patients in the operating room and outside the operating room who specialize in cardiac patients. We have coordinators who have been doing it for over 20 years. We have a dedicated team of pharmacists and infectious disease specialists, along with psychologists and social workers who really have everything it takes to get people through the process.
All right. Great information. Dr. Jonathan Hammond with Hartford Hospital talking the latest in heart transplants. Thanks for being with us. We appreciate your information. Good stuff.
My pleasure.